The Depressive Case of Andrew Larchman, presented by Andrew Lim and featuring the film Garden State. The context of Andrew Larchman's life so far. The story of the film Garden State first portrays Andrew Larchman as a depressed actor living in Los Angeles, California, who knows nothing but medication pills and numbness in emotions and feeling. When he was a child, Andrew Larchman pushed his mother over a dishwasher door in a fit of rage, only to have her spine broken. Although the incident was wholeheartedly accidental on Larchman's part, his father, a psychiatrist by the name of Gideon, prescribed to him medications such as lithium in order to help Larchman avoid the emotions of guilt that were to come. Rather than actually having Larchman work through the experience and emotional consequences that would follow such a tragedy, his father Gideon sends him away to private school and ensures that he takes loads of antidepressants, mood stabilizers, and anti-anxiety medications. His parents end up sheltering him from any kind of emotion for the rest of his adolescent years, which overall reflects the American culture in seeking quick, shortcut solutions such as medications rather than going through real emotional experiences. However, as the film progresses, Largeman finds support in his childhood friends and his love interest named Sam, quitting the drugs he is taking and eventually developing his own purpose in life. Disorder diagnosis. Now, the disorder that is diagnosed for Andrew Largeman is depressive disorder, and more specifically, the persistent depressive disorder. Now, the Diagnostic and Statistical Manual of Mental Disorders contains over 350 disorders, with the category of mood disorders relating to the case of Andrew Largeman in particular. As the film progresses, Largeman's mannerisms reveal a form of depression known as persistent depressive disorder that is mild in intensity but longer in duration than the classification of a major depressive disorder. For most of his young adult years, he has been unable to truly feel emotion and lacks the energy and motivation to enjoy anything in life. His actions are lethargic, and he only does what is necessary to survive, taking medications to avoid any sort of pain associated with feelings. Largeman is introduced as an individual who does not seem to care for the company of others, even including his family. Supporting factors for diagnosis. The symptoms displayed include reduced interest or pleasure in doing anything, along with daily feelings of worthlessness, self reproach, or excessive guilt. Now, going with the first symptom that's displayed, though Andrew Largeman does go to a party involved with friends, drugs, and all other types of quote unquote fun, he displays no sign of enjoyment nor any indication of acknowledgement for the actions taking place around him. He just seems to go through the motions and go with the flow of everyone around him, instead of thinking for himself and deciding what he should and should not do. The second symptom, daily feelings of worthlessness, self reproach, or excessive guilt. Largeman has come to believe for quite some time that his mother became a paraplegic because he broke her spine and as a result inadvertently caused her death when she drowned in a bathtub years later. He also did not seem to show any sign of remorse when being criticized by the people he was serving as a waiter at the restaurant he is working in, taking on harsh words without any care in the world. Both of these instances clearly indicate the guilt he constantly lives with and the perceptions of self reproach, respectively. A missing symptom in the case of his depressive disorder would be significant change in body weight. One of the numerous symptoms that patients diagnosed with any kind of depressive disorder typically involves change in body weight as a result of either dieting or overeating, which is absent in the case of Andrew Largeman. He displays other symptoms that have to do with lack of care or emotions, along with daily fatigue and not being able to concentrate clearly. However, a major symptom such as alterations in bodily appearance and weight have proved to be consistent, and Largeman's eating habits are not exhibited at all within the film as well. Possible treatment. Although different classes of drugs do exist to treat depression, such as MAO inhibitors, tricyclic antidepressants, SSRIs, and bupropion, in Andrew Largeman's situation, medication is the last thing he needs. Since his father's prescribed drugs have repressed Largeman's emotions for years, additional pills would only make the numbness of his feelings even worse. Now, the combined approaches of both drugs and psychotherapy may be effective in unison, though humanistic or positive therapy would work best in Largeman's case. Even in the film itself, he most definitely shows improvement when he stops taking his prescribed pills and starts to interact with the people he cares about, including his childhood friends and the girl he begins to fall in love with. Though the use of humanistic or positive therapy, the long term projected outcome would be a stronger sense of confidence in himself, perception of positive self worth, and a greater will to strive for self fulfillment. The film does this in a way by allowing Largeman to vent his thoughts and eventually emotions to his love interest Sam, gradually causing him to open up and accept that the passing of his mother was not his fault, along with being able to embrace all the good and the bad that life has to offer. Possible treatment continued. Electroconvulsive therapy would also be a possible avenue of treatment for Largeman. However, this form of therapy is usually used as a last resort to treat patients who are diagnosed with the most severe cases of depression and have not responded to other forms of therapy. Electroconvulsive therapy is administered through electrodes that connect to a patient's head, carrying a non lethal electrical current, usually around 60 to 140 volts. The treatment induces a brief seizure along with bodily convulsions, with patients reporting immediate relief from their symptoms afterwards in regards to their depressive disorders. However, some negative side effects consist of memory loss and the fact that relief from the symptoms only lasts for a brief period of time. Conclusion. Ultimately, humanistic or positive therapy outweighs electroconvulsive therapy in regards to the ethics involved and how effective the therapies are in comparison to each other. Humanistic therapy provides constructive counseling sessions that provide a path away from medications, while ECT may cause cognitive damage and a lack of lasting relief. Humanistic therapy does not jeopardize any chances of violating ethical codes and does just the opposite. It ensures that patients create senses of gratitude and develop their own definitions of happiness. Depression as portrayed in the film. Garden State as a whole does an excellent job in presenting depression as a real disorder that exists in today's society, with all its implications surrounding medications, numbness in emotions, and a lack of care for oneself along with the world. The film itself is able to portray Largeman's lethargy and his bad habits, such as arriving late to his job as a waiter and his indifference for the events that transpire around him, with such an example being the fact that he did not shed a single tear at his mother's funeral. Largeman even states that rather than bearing emotions, he just remained empty and neutral throughout the entire ceremony. The movie does have a bit of a cheerful outcome, to say the least, and without spoiling the ending. However, the movie is not realistic in the sense that there are not always happy endings. Just because one is surrounded by positive people does not automatically guarantee happiness nor victory over depression. Also, it is highly unlikely that a psychiatrist would have his or her patients take the same medications for years without ensuring the pills are effective. Overall, Garden State is successful in depicting America's perspective on depressive disorders with its issues of addictions to pills and other types of shortcuts, along with feelings of worthlessness that many patients go through. Films are generally idealistic when it comes to patients overcoming their psychological disorders, although they carry out an essential job in spreading awareness about the individual struggles that occur on a day to day basis. Depression, as portrayed in the film, continued. Films such as Garden State allow us to have a sense of empathy in understanding the issues that individuals with psychological disorders have to fight through. They may be estranged from society, seen as outcasts, even given up on by the people who surround them. However, with more and more people becoming attentive to these disorders, there is now greater hope that individuals such as us will lend a helping hand in assisting these people to live better, happier, and more appreciative lives.